So what happens in this version is patient comes to you with a small lung cell carcinoma, like there is a history of the lung carcinoma, for example, risk factor smoking, decrease of the weight, and blah, 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 blah. And you know it's a small cell. Why? Because there is like a decrease in the sodium. Why? Because we know there is inappropriate ADH. So ADH anti-diuresis. So it is not going, the diuresis is not happening. Why? Because there's a decrease in the volume. But it is appropriate. Even there's like a good amount of volume, still is like a volume retention. And when there's like a volume retention, then there's going to be a decrease in the sodium. Because if we have like 1 glass of water and we like put a tablespoon of like the salt, so it's fine. But if we take a 1 pan of the water, like add into this, so the sodium will be diluted. So what is happening over here, that ADH is inappropriate. Even with the volume, it's still retaining, so sodium becomes very less. So when it comes to very less, you have anorexia, you have the forgetfulness, you might the seizure and coma and blah, 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 blah. So the other symptoms, the first you need to do is restrict the water. Like it should be around 800 ml, more than that. We give the albumin when there's cirrhosis or stuff like that, when albumin is not formed. So you cannot hold the water, so because you don't got a pressure. In those conditions, we do give albumin. Or if we have given the salt glass and we have given the fluid restriction and we have done everything, it's not getting better, then we give the shot of it. Demeclocycline antagonists ADH into the collecting tubule of the kidney. We can give that, but in a refractory because it is toxic to the kidneys. And we don't give these. We don't need it. No, no, no. So yeah.